morning. Welcome to Conversations with Dr. Johnson.
Good morning.
How are you doing today, Dr. Johnson?
Great, thank you.
All right. So we missed one yesterday because Dr. Johnson and I were too busy. I apologize. Deep apologies. We forgot about you and we let you down. So we apologize.
Yes, we
right,
did.
Dr. Johnson. Totally just forgot. We were at the bank, and you know banks. By the way, so today we're going to talk about your GI tract and your immune system.
Okay.
Why are these two things connected, Dr. Johnson?
Well, I guess we'd have to ask God that, but you know, our GI system is one of our main ways of interacting with the outside world.
Yes.
Certainly we interact with our skin, with our senses, our eyes, our
nose,
our hearing, our taste, and,
Yeah.
and our touch. But the GI system is actually thought of as almost as if it's outside the rest of the body.
Yeah.
Okay. It's a tube with an opening here and another opening at the other end, and so
and a P.
well, that's different.
Different
That's
system. Yeah,
different.
I didn't. Oh, you were not going to go there.
No,
So just
wasn't
the
gonna go
opening
there.
here and the opening here. So it's like a pipe.
Yes, indeed.
Mm-hmm.
And so, in a very real sense, what goes on outside the body is separate from what goes on inside the body. And so, since our immune system, its main job is to prevent us from getting infections,
Yes.
then it sort of makes sense that our GI tract, which does interact with the outside world, is an important part of our immune system.
Almost a very large part of it.
Very large part, yes.
And just to correct Dr. Johnson, she said the immune system just prevents. It also responds and fights of infections, right?
Well, that's part of it, yes.
Yes. So
Yes.
prevention and the fighting, the response when there's infection. So how then do we maintain, since we are saying the GI is a critical part of that immune system, how do we ensure that we don't distract our immune system with the ongoings of the GI?
Okay. Well, the first thing is to eat a healthy diet.
Okay.
We need to do our best to avoid refined sugar.
Yeah.
We need to do our best to avoid most starches. We need to eat adequate protein. We need to eat healthy fats because the cells lining our GI tract rely on these things to get the nutrients they need to be healthy.
Okay.
And to keep our immune system healthy.
Yeah, I know that when we talk about the GI tract and the whole absorption and breakdown of food, there is the issue of tight junctions.
Yes.
Yes, and so you were talking about fat. So talk to us. What is the function of that tight junction and why is that very important for immune health?
Okay, so if we're looking through a very powerful microscope at the individual cells in the lining of our gut, the cells are supposed to be close together, tightly.
Yeah.
Okay, so this is a tight junction. This prevents partially digested food particles and toxins from getting into the bloodstream because
Yes.
when something goes through the tight junction, it's then absorbed into the bloodstream.
Yeah.
Okay, and so that tight junction needs to be tight so that the bad stuff gets rejected and not absorbed into the bloodstream.
We know that
Yeah.
that is the source for a lot of illnesses.
Yes, yes.
Yes, go ahead.
So when these tight junctions become loose,
Yes.
we call that leaky gut syndrome because
Yes.
things leak from our gut out into our bloodstream, things that don't belong in our bloodstream.
And then the immune system fight now transfers inside
Yes.
rather than outside
Yes.
where its job was supposed to be.
Yes,
So
yes.
leaky gut leads to a compromised immune system, would you say?
Yes. So think of the tight junctions as the moat around the castle
Yes.
that prevents the bad guys from getting
coming
in.
in, yeah.
But if they breach the moat and they get inside the castle, if the bad stuff gets into our bloodstream, then it's a much more difficult fight.
Yeah.
And we have to work harder. So keeping our tight junctions tight and healthy is a very valuable thing. And we do that by eating healthy food. We eat that by making sure that we have plenty of friendly bacteria in our gut.
And how do we do that? Getting more... I don't understand. How does friendly bacteria, what does it got to do with leaky gut? What's the relationship?
Okay. So the friendly bacteria in our gut produce all sorts of chemical compounds that help keep those tight junctions tight and healthy.
Okay.
Okay? And so...
And the bad bacteria want to break through.
Yes.
They're like the bad boys.
Yes.
Yeah, so it's like your security at the moat and the bad people who want to attack, right?
Exactly.
So you want to make sure your security doesn't fall asleep.
Yeah, we want to make sure that moat is wide enough and deep enough and well defended.
Yeah, and
Yes.
so the bad people would drown.
Yes.
And
Yes.
die.
Yes.
Before they even get to our security team.
Right.
What else do we do to strengthen that tight junction?
Well, our pancreas is supposed to produce something called digestive enzymes.
Yeah.
Enzymes that are required to digest our food. As we age, for most of us, that pancreas becomes less and less efficient at producing enzymes. So some of us need to take digestive enzymes when we eat food. So,
right.
so healthy diet, probiotics, digestive enzymes are the biggies.
All right. What about fiber? I know that is also an important part on that GI architecture.
Well, yes, and of course that's part of the healthy
The
diet.
diet.
A healthy diet will always contain lots and lots of fiber.
Yeah, I wanted to emphasize that point.
Yeah, no, that's very important.
Yeah.
And basically, the fiber that we consume is food for our good bacteria, our probiotics, our friendly bacteria.
Very important issue.
Yes.
So leaky gut
Yes.
and immune system. So at this time when we're talking about flu season and COVID,
Yes.
people are focusing just on immune system, but also there should be a very big focus on getting your GI tract sorted.
Well, sure, because that is necessary to have a strong immune system.
Wonderful.
Yes.
So any closing thoughts on this issue that you want to give? How is your GI? How are your tight junctions? Are they very tight? How would we know that?
We couldn't slip a piece of paper between them.
But some viruses can sneak through.
Yeah.
Yeah, they do. So how do we test?
Well, there are several ways that you can test. You can get stool samples. There are certain blood and urine tests that can be helpful.
Yeah.
And probably my favorite way of testing for leaky gut is with something called IQS testing. It's an electronic body function scan.
Yes.
We're measuring minute fluctuations of energy flow through the body's acupuncture meridians, and it can give us an amazing amount of detail.
Without actually collecting stool.
Yes, and without being invasive.
All right.
Yeah,
That's wonderful.
and it can tell us if we have hidden bacteria, viruses, mold, yeast, fungus, parasites.
Okay.
It is generally thought in the medical profession in this country that parasite infections in the gut are very rare in our population. There are other people in the holistic community that say, oh no, everybody has parasite infections.
Yes.
Well, the truth lies in between those two extremes. Parasites are far more common than is generally thought by mainstream doctors, but still the majority of people do not have parasites. Based on what I've seen in my patient population, my best estimate is about 15 to 20%
have parasites.
of Americans have parasites.
Yeah, well, we all have parasites. You mean a certain amount?
Well, I'm talking about an amount that would be pathogenic, which means disease-causing.
All right. And so it's in the variety and the number of those parasites.
Yeah.
All right.
When I was growing up in Colorado, we used to go camping and hiking up in the Rocky Mountains all the time. And we'd run across a stream, and we would always drink out of it, and it was perfectly safe.
Yes.
Nowadays, all of those streams are contaminated with Giardia, which is the name of a particular nasty GI parasite.
Wow! So you can't drink from those streams anymore.
Well, you can, but you will pay the price for it.
But what about the fish that is in those streams? So if you eat them, you also have this bacteria?
Well, that's a great question. I'm not really sure. Because
they still do fishing in those places,
well,
right?
Sure, but there are parasites that infect humans and not other animals, and vice versa.
Right, yes.
Does Giardia infect the fish? My guess is no, but I don't know that for sure.
All right, wonderful.
I'm not an ichthyologist.
Another big word, Dr. Johnson.
That's a fish expert.
Oh, all right. So thank you, Dr. Johnson, for today. Love us, like us, send us questions. And tomorrow we'll take another topic of interest. And we're staying on this immune system thing because it is a really powerful tool for staying healthy and alive during this flu and COVID-19 season. Thank you, Dr. Johnson.
Thank you. It's my pleasure.
For another wonderful conversation.
My pleasure.
Thank you for joining.